Hey there, future nursing rock stars. Welcome back to the channel. You're in for a treat because today we're diving into the Ultimate Stroke Nursing Challenge for NCLEX 2025. Are you ready to sharpen your skills and conquer one of the most repeated topics on the NCLEX? In this video, we've packed 40 high-stakes NCLEX-style questions that will test your stroke care expertise from acute management to long-term recovery. Expect clear answers, detailed rationales, and pro tips to boost your clinical judgment and ace the next-gen NCLEX. Whether you're a nursing student or prepping for a retake, this is your chance to level up. Hit that subscribe button, ring the bell for updates, and drop your thoughts in the comments. We're here to help you shine. Let's get started and crush that NCLEX together. 1. What is the priority nursing action for a patient experiencing an acute ischemic stroke? A. Administer thrombolytic therapy. B. Encourage oral intake. C. Perform a lumbar puncture. D. Apply a heating pad to the affected area. Answer: A. Administer thrombolytic therapy. Rationale: administering thrombolytic therapy, for example, TPA within the therapeutic window, typically 3 to 4.5 hours, is critical to restore blood flow and minimize brain damage in ischemic stroke. B. is incorrect, as oral intake risks aspiration due to potential dysphagia. C is inappropriate as it increases intracranial pressure risk. D may worsen tissue damage by increasing blood flow to the affected area. 2. Which assessment finding requires immediate intervention in a patient with a hemorrhagic stroke? A. Blood pressure of 140/90 mmHg. B. Sudden decrease in Glasgow Coma Scale score. C. Mild headache. D. Slight facial droop. Answer: B. Sudden decrease in Glasgow Coma Scale score. Rationale: a sudden decrease indicates worsening neurological status, possibly due to increased intracranial pressure or rebleeding, requiring immediate action. A is within acceptable limits post-stroke. C and D are less urgent and require monitoring rather than immediate intervention. 3. What is the most appropriate initial action for a nurse when a patient exhibits signs of a stroke? A. Perform a detailed neurological exam. B. Activate the stroke code or call the rapid response team. C. Administer aspirin immediately. D. Order a CT scan. Answer: B. Activate the stroke code or call the rapid response team. Rationale: activating the stroke team ensures rapid assessment and intervention, aligning with the time-sensitive nature of stroke care. A is secondary to activation. C is contraindicated until stroke type is confirmed. D is a physician order, not a nurse's initial action. 4. Which position is best for a patient with increased intracranial pressure following a stroke? A. Flat on back. B. Head elevated 30 degrees. C. Prone position. D. Trendelenburg position. Answer: B. Head elevated 30 degrees. Rationale: elevating the head 30 degrees promotes venous drainage, reducing intracranial pressure. A increases pressure, C restricts airway, and D worsens cerebral edema. 5. What is the priority nursing intervention for a stroke patient with dysphagia? A. Encourage large sips of water. B. Assess swallowing ability before feeding. C. Provide a regular diet. D. Administer oral medications without assessment. Answer: B. Assess swallowing ability before feeding. Rationale: assessing swallowing prevents aspiration, common complication in stroke patients with dysphagia. A. C and D risk aspiration without prior evaluation. Which medication is most appropriate for a patient with an ischemic stroke within the therapeutic window? A. Warfarin. B. Altplace. C. Heparin. D. mannitol. Answer B. Altplace. Rationale? Altplace. TPA. Is the thrombolytic agent used to dissolve clots in ischemic stroke within 3 to 4.5 hours? A and C are anticoagulants not used acutely, and D treats edema, not clot dissolution. 7. What is the best way to monitor a stroke patient's neurological status? A. Check vital signs every 4 hours. B. Use the NIH stroke scale regularly. C. Perform a full physical exam daily. D. Assess only motor function. Answer B. Use the NIH stroke scale regularly. Rationale. The NIH stroke scale provides a standardized, comprehensive assessment of neurological deficits aiding in tracking changes. A is too infrequent, C is overly broad, and D is incomplete. 8. Which finding on a CT scan indicates a hemorrhagic stroke? A. Hypodense area. B. Hyperdense area. C. Normal brain tissue. D. Ischemic penumbra. Answer B. Hyperdense area. Rationale. A hyperdense area on CT indicates blood, confirming hemorrhagic stroke. Suggests ischemia. C is normal, and D is a reversible ischemic zone, not hemorrhage. 9. What is the priority nursing action for a stroke patient with a risk of aspiration? Place in a supine position. B. Keep the head of the bed elevated. C. Offer thick liquids only. D. Encourage rapid swallowing. Answer B. Keep the head of the bed elevated. Rationale. Elevating the head reduces aspiration risk by promoting gravity-assisted swallowing. A. Increases risk. C is secondary to positioning, and D may worsen aspiration. 10. Which patient education topic is most important for a stroke survivor? A. Importance of smoking cessation. B. Need for daily aspirin. C. Benefits of high-sodium diet. A. Avoidance of physical therapy. Answer A. Importance of smoking cessation. Rationale. Smoking cessation reduces recurrent stroke risk by improving vascular health. B. Requires physician guidance. C. Worsens hypertension. And D. Delays recovery. 11. What is the most appropriate intervention for a stroke patient with hypertension? A. Administer for antihypertensives as ordered. B. Encourage fluid overload. C. Discontinue all medications. D. Apply a cold pack to the neck. Answer A. Administer for antihypertensives as ordered. Rationale. Controlled reduction of blood pressure with 4 antihypertensives prevents further brain damage. B. Worsens edema. C. Is unsafe. And D. Is ineffective. 12. Which sign suggests a stroke patient is experiencing a seizure? A. Steady gait. B. Uncontrolled jerking movements. C. Clear speech. D. Normal pupil response. Answer B. Uncontrolled jerking movements. Rationale. Jerking movements indicate a seizure. Complication post-stroke due to brain irritation. A, C, and D are normal or unrelated findings. 13. What is the priority action when a stroke patient shows signs of increased intracranial pressure? A. Administer mannitol. B. Elevate the legs. C. Increase oral fluids. D. Perform a lumbar puncture. Answer A. Administer mannitol. Rationale. Mannitol reduces intracranial pressure by osmotic diuresis. Priority in acute management. B and C worsen pressure, and D risks herniation. 14. Which laboratory value is most critical to monitor in a patient on anticoagulant therapy post-stroke? A. Blood glucose. B. INR. C. Hemoglobin. D. Potassium. Answer B. INR. Rationale. INR monitors anticoagulant effectiveness, for example. Warfarin. ensuring therapeutic levels to prevent clotting or bleeding. A, C, and D are less relevant. 15. What is the best nursing intervention to prevent deep vein thrombosis in a stroke patient? A. Encourage bed rest. B. Apply sequential compression devices. C. Administer 4 fluids. D. Restrict movement. Answer: B. Apply sequential compression devices. Rationale: sequential compression devices promote circulation, reducing DVT risk in immobile patients. A, C, and D increase risk. 16. Which communication strategy is most effective for a stroke patient with aphasia? A. Speak rapidly and loudly. B. Use simple phrases and gestures. C. Avoid eye contact. D. Ask complex questions. Answer: B. Use simple phrases and gestures. Rationale: simple language and gestures facilitate understanding in aphasic patients.
But
A. Overwhelms. C. Reduces engagement. And D. Confuses. 17. What is the priority nursing action for a stroke patient with a facial droop? A. Perform a swallowing assessment. B. Apply a facial mask. C. Encourage chewing gum. D. Massage the face. Answer: A. Perform a swallowing assessment. Rationale: facial droop may indicate dysphagia, requiring assessment to prevent aspiration. B, C, and D are inappropriate or ineffective. 18. Which position is contraindicated for a patient with a hemorrhagic stroke? A. Head elevated 30 degrees. B. Flat supine. C. Side lying. D. Trendelenburg. Answer: D. Trendelenburg. Rationale: Trendelenburg increases intracranial pressure, worsening hemorrhagic stroke. A, B, and C are safer positions. 19. What is the most important teaching point for a stroke patient on antiplatelet therapy? A. Take with grapefruit juice. B. Report black stools immediately. C. Skip doses if feeling well. D. Increase alcohol intake. Answer: B. Report black stools immediately. Rationale: black stools indicate gastrointestinal bleeding, a serious side effect of antiplatelets. 8C and D increase risks or reduce efficacy. 20. Which assessment finding indicates a stroke patient is at risk for falls? A. Steady hand grip. B. Unilateral weakness. C. Clear vision. D. Normal balance. Answer: B. Unilateral weakness. Rationale: unilateral weakness impairs mobility, increasing fall risk. A, C, and D suggest stability. 21. What is the priority intervention for a stroke patient with a suspected pulmonary embolism? A. Administer oxygen. B. Encourage ambulation. C. Delay notification. D. Apply a tourniquet. Answer: A. Administer oxygen. Rationale: oxygen improves oxygenation in pulmonary embolism, life-threatening complication. B. Risks dislodging clots. C. Delays care. And D is contraindicated. 22. Which diet modification is most appropriate for a stroke patient with hypertension? A. High sodium diet. B. Low sodium diet. C. High fat diet. D. Increased sugar intake. Answer: B. Low sodium diet. Rationale: a low sodium diet helps control hypertension, reducing stroke recurrence risk. A, C, and D exacerbate hypertension. 23. What is the best way to assess a stroke patient's swallowing reflex? A. Offer a full meal. B. Use the water swallow test. C. Check tongue movement only. D. Observe breathing pattern. Answer: B. Use the water swallow test. Rationale: The water swallow test evaluates swallowing safety, preventing aspiration. A is unsafe, C is incomplete, and D is unrelated. 24. Which sign requires immediate reporting in a stroke patient on heparin? A. Mild bruising. B. Frank blood in urine. C. Slight dizziness. D. Warm skin. Answer: B. Frank blood in urine. Rationale: frank blood indicates hemorrhage. A severe heparin side effect requiring immediate action. A, C, and D are less urgent. 25. What is the priority nursing action for a stroke patient with a fever? A. Apply a cooling blanket. B. Administer antibiotics. C. Increase room temperature. D. Encourage heavy clothing. Answer: A. Apply a cooling blanket. Rationale: a cooling blanket reduces fever, preventing further brain injury in stroke patients. B. Requires a diagnosis. C and D worsen hyperthermia. 26. Which intervention is most effective for preventing contractures in a stroke patient? A. Passive range of motion exercises. B. Bed rest. C. Weight-bearing activities. D. Splinting only. Answer: a passive range of motion exercises. Rationale: passive exercises maintain joint mobility and prevent contractures and paralyzed limbs. B, C, and D are insufficient or contraindicated. 27. What is the most appropriate response to a stroke patient's family asking about prognosis? A. Provide a definitive outcome. B. Explain the uncertainty and ongoing assessment. C. Avoid the topic. D. Suggest alternative treatments. Answer: B. Explain the uncertainty and ongoing assessment. Rationale: honest communication about prognosis uncertainty fosters trust, while ongoing assessment guides future care. A is speculative, C is dismissive, and D is premature. 28. Which finding on the NIH stroke scale indicates severe stroke? A. Score of 2, B. Score of 15, C. Score of 5, D. Score of 0. Answer: B. Score of 15. Rationale: a score of 15 out of 42 indicates severe neurological impairment. A and C suggest mild to moderate, and D is normal. 29. What is the priority action for a stroke patient with a suspected seizure? A. Restrain the patient. B. Protect the patient from injury. C. Administer sedatives immediately. D. Ignore mild twitching. Answer: B. Protect the patient from injury. Rationale: protecting from injury prevents harm during a seizure. Restraint and sedatives are not initial actions unless ordered. D delays care. 30. Which medication should be avoided in a patient with a hemorrhagic stroke? A. Acetaminophen. B. Warfarin. C. Clopidogrel. D. Atorvastatin. Answer: B. Warfarin. Rationale: warfarin, an anticoagulant, increases bleeding risk in hemorrhagic stroke. C and D are safer or less impactful. 31. What is the best way to promote mobility in a stroke patient with hemiplegia? A. Use a walker independently. B. Assist with physical therapy. C. Restrict movement. D. Apply weights to the affected side. Answer: B. Assist with physical therapy. Rationale: assisted therapy promotes mobility and prevents complications in hemiplegia. A. Is unsafe. C. Delays recovery. And D. Worsens weakness. 32. Which assessment is most important before administering TPA? Blood pressure only. B. History of recent surgery. C. Pupil response. D. Skin turgor. Answer B. History of recent surgery. Rationale: recent surgery is a contraindication for TPA due to bleeding risk. A, C, and D are less critical for TPA eligibility. 33. What is the priority nursing action for a stroke patient with a suspected aspiration? A. Suction the airway. B. Encourage coughing. C. Position on the affected side. D. Offer water to clear the throat. Answer: A. Suction the airway. Rationale: suctioning removes aspirated material, preventing respiratory compromise. B, C, and D may worsen aspiration. 34. Which intervention helps reduce edema in a stroke patient? A. Elevate the head of the bed. B. Administer 4 fluids. C. Apply heat to the head. D. Lower the bed flat. Answer: A. Elevate the head of the bed. Rationale: elevation promotes venous drainage, reducing cerebral edema. B, C, and D increase fluid or pressure in the brain. 35. What is the most important safety measure for a stroke patient with impaired vision? A. Keep the room dimly lit. B. Remove obstacles from the path. C. Encourage independent walking. D. Use restraints. Answer: B. Remove obstacles from the path. Rationale: clearing obstacles prevents falls in patients with visual impairment. A, C, and D increase risk or are inappropriate. 36. Which finding indicates a stroke patient is improving? A. Increased confusion. B. Improved grip strength. C. Worsening speech. D. Elevated blood pressure. Answer: B. Improved grip strength. Rationale: improved grip strength suggests neurological recovery. C and D indicate deterioration or unrelated issues. 37. What is the priority action for a stroke patient with a suspected urinary retention? A. Insert a urinary catheter. B. Encourage fluid restriction. C. Perform a bladder scan. D. Administer diuretics. Answer: C. Perform a bladder scan. Rationale: a bladder scan assesses retention non-invasively, guiding further intervention. A B and D are premature or inappropriate without assessment. 38. Which teaching point is essential for a stroke patient on a low cholesterol diet? A. Include fried foods. B. Choose lean meats and vegetables. C. Avoid all fruits. D. Increase butter intake. Answer: B. Choose lean meats and vegetables. Rationale: lean meats and vegetables reduce cholesterol, lowering stroke recurrence risk. A, C, and D counteract this goal. 39. What is the best way to manage a stroke patient's risk of depression? A. Limit social interaction. B. Encourage family support and counseling. C. Prescribe antidepressants independently. D. Ignore mood changes. Answer: B. Encourage family support and counseling. Rationale: support and counseling address depression, common post-stroke, promoting mental health. C and D are harmful or inappropriate. 40. Which intervention is most effective for preventing pressure ulcers in a stroke patient? A. Reposition every 4 hours. B. Reposition every 2 hours. C. Use a donut cushion. D. Keep the patient supine. Answer: B. Reposition every 2 hours. Rationale: repositioning every 2 hours relieves pressure, preventing ulcers in immobile patients. A is insufficient, C increases pressure, and D promotes ulcer formation.